Welcome to this episode of the Twin Sisters Doctor Podcast. Thank you to all of our viewers who have returned to listen and view. And thank you for all of our new listeners and viewers. I am Dr. Elena McDonald, board-certified general pediatrician, and I am Dr. Delana Wardlaw, board-certified family medicine physician. And together, we are the Twin Sisters Docs. Today, we're going to be talking about the difference between urgent care and the emergency room.
Yes.
You know, you have your primary care doctor's office. You know, you go there for your regular routine visits. You know, you go there for some, just for sick illnesses as well, for illnesses as well. Viruses, sore throat, stomach aches, headaches, a lot of chronic illnesses, conditions, and acute illnesses. You go to your regular doctor for. However, there are some instances where you need an extra level of care, a more urgent level of care. Say if you fall and break your arm,
You need an X-ray.
Yeah, you'll need an X-ray, and most doctors' offices do not have an X-ray in their office. Some do, but many do not. Most do not. So you would need an extra level of care. So urgent care would be appropriate for that. Or if you cut yourself with your knife in your kitchen, you know, urgent care is appropriate for that. You can go there, get some stitches put in, and have that taken care of. Now, urgent care
is also good for if it's after 7 o'clock at night, 8 o'clock at night, your doctor's office is closed, your child is having severe ear pain, and that cannot wait until tomorrow. It's appropriate to take them to the urgent care for that.
Urgent care is a bridge between your doctor's office and the emergency room. But people have to realize that it's for urgent instances that Dr. McDonald and I just talked about, you know, bruises, you know, cuts, fractures. However, emergency room is for emergencies. Now, we want to be clear on this. Emergencies. You're having chest pain, you feel like you're having a heart attack, go to the emergency room. If you are having shortness of breath, go to the emergency room. If you are having excessive bleeding from any orifice, go to the emergency room.
And when you say orifice, she means whether or not it's your mouth, whether it's your nose, it's your eyes, it's your rectum, it's your vagina, you have to go to the emergency room if it's severe, significant bleeding.
Yes. So that is an emergency. If you notice that someone is acutely confused, that is an emergency. If you notice they are showing signs and symptoms of a stroke, their face may be crooked. They may be having speech that you do not understand. They may be having weakness on one side of their body. They may be having a facial droop, or they may be having an issue where they are not responding to you the way that you normally used to them responding. Those are emergencies. You have to go to the emergency room. Now, we talked about a laceration or a cut if you cut yourself with a dinner knife. You go to the emergency room. Or if you get bit you go to the urgent care. Or if you get bit by a dog, you go to the urgent care. But if, you know, God forbid, if someone is stabbed or if someone suffers from a gunshot wound, then of course, those are trauma events. Those have to go to the emergency room. So again, and if you have to err on the side of caution, you should go to the emergency room if you're erring on the side of caution, if you're just not sure of what to do.
And I always tell my parents and my patients reasons to go to the emergency room. If your child is having significant trouble breathing, they're not responding to their asthma medications, and you've given it to them as frequently as you've been instructed to give them, or they are dehydrated. They are not drinking, they're having vomiting, they're having diarrhea, but they are not going to the bathroom. They're not wearing their diaper. They don't have saliva in their mouth. They're not making tears. Those are significant signs of dehydration. You want to go to the emergency room. Or if your child is simply just not responding to you. Not that they're super sleepy, but if they are not responding to you, you need to take them to the emergency room. So these are other instances where you need to go to the emergency room.
And if it's during the daytime, call your doctor's office. I get plenty of calls during the daytime where a patient will call and say, "Oh, I'm having chest pain. Is it okay for me to come into the office?" No. Great. I'll assess the patient. Oh, you need to go to the emergency room over the telephone. Or, Dr. Boyle, I have this rash and, I'm just not quite sure what it is. And it's 4:45 in the afternoon and the office is grade closed. Okay, you should go to urgent care. So don't hesitate to get advice from your doctor as well as to whether you need to, as to what avenue you need to take. Urgent cares. Now, of course, the emergency room is open 24/7.
Right. They will see you.
Mm-hmm.
The emergency room will see you if you come to the emergency room. So Dr. Warlow's point, the urgent care also closes at a certain time,
Yes.
but they may not close until 9, 10 o'clock in the evening. So they are another option. And sometimes you may go to urgent care and the urgent care doctor may say, this requires a higher level of care. You're going to need to go to the emergency room. So if you're not sure, again, start with your doctor. If you go to the urgent care and the urgent care says high level care, we need to refer you. If you go to the emergency room is not going to tell you shouldn't be here. However, it backs up the emergency room and you wait for hours and hours and hours on end because that's not something that you really should have been in the emergency room for. So that's why we are trying to educate people as to what makes it necessary to go to the emergency room. Because in the middle of the wintertime, you are sitting in that emergency room for hours and hours and hours. And if you've had a cough for a week, no need to go to the emergency room. Now, if you've had a cough for a week and all of a sudden you're having severe trouble breathing, you should be at the emergency room. If you've had constipation for the last 4 weeks, no need to decide to go to the emergency room that evening because I need to get this taken care of right now. Again, when the emergency rooms get super backed up, it just delays care. It delays resources because let's be clear, the emergency room is not first come, first serve.
Nope, not
it
at all.
is not like the local post office. You get there, you wait in line, you wait your turn. No, the emergency room is by order of severity. There is what we call a triage process. When you walk into that door, you are assessed the level of severity, and that determines how quickly you are seen.
Yes, and so the amount of time that you spend in the emergency room oftentimes indicates if this was something that probably could have been handled in the next day or 2 or 3 at your primary care doctor's office, or if it could have been addressed at urgent care. So again, it's why we try to use these platforms to give people an idea of what the proper use is. Now,
you're not going to the emergency room because it's convenient for your schedule. You're going to the emergency room because you have a true emergency.
Emergency. And again, as Dr. McDonald said, it could back up resources because some emergency rooms sometimes have to close their doors. And what that means is that if an emergency room reaches its full capacity where it can no longer treat patients in a safe manner, then you may hear the term diversion, where the ER will close its doors to ambulance and transportation, and for patients to come in, they will have to go to another hospital. Now, it doesn't mean that if you show up to the hospital, you're having chest pain, they're going to turn you away and say, no, we don't have any space here for you. But what it does mean, if you call an ambulance and you're used to going to Temple University and their doors are closed for the evening for a certain period of time because they have reached their maximum level of capacity, then you very well could be routed. The ambulance will be rerouted up the road to, or they'll even say the ambulances will know ahead of time, oh, we can't take you to this facility because they're on diversion. So we have to take you to another facility. And so even though your doctors may be at Temple University, you may very well wind up Albert Einstein or at Thomas Jefferson because
they're able to take you at that particular time.
And because they are the ER is full. So again, this is why it is very important for us to utilize the resources that are available to us, because it can cause a cascade of effects. It can cause an effect on care that people receive. And the other thing is, if, as Dr. McDonald said, it's all based on severity. And we know we live in Philadelphia. We know that, unfortunately, we see a lot of traumas, whether it is, accidental traumas, whether it is, intentional traumas, whether it's car accidents, whether it's gunshot wounds, whether it is knife wounds. So we see a lot of traumas in the city of Philadelphia. And so if you're in the emergency room and you're waiting there for 6 hours already, and you have a cold and a trauma rolls in,
you're going to wait another 4 hours.
yes,
Because the trauma consumes all of the resources, rightfully so.
yes,
Because you have to address that emergent situation immediately. But again, our goal is to educate individuals is when it is time to go to the emergency room. And if you are not sure, yes, you can reach out to your doctor's office to find out should I be going to the emergency room? The emergency room is there for a reason, but it's not there for every reason. And we have to be very careful about that. And hospitals do not go on divert lightly.
Nope.
That is a major decision that has to be made when the hospital really is at full capacity. And as a physician, I have been told when I have had patients that I need for the EMS services to come pick them up and say, I want them to go to this particular hospital. In the middle of the wintertime, I've been told, unfortunately, that hospital will divert. I have to take you to this hospital. I have to take your patient to this hospital. So it happens. And again, while we don't want it to happen often, it does happen because the ERs become so over full. They oftentimes they go past capacity.
And another issue is that many people don't have access to a primary care physician. That's the other part of the problem. And so those people, unfortunately, don't have the benefit of being able to call their doctor, to being able to get advice, or being able to wait until the office opens the next day to be able to go in and be seen. So we do understand that there are some circumstances then where people don't have the ability to, or don't have access to primary care. That is a systemic issue that
Has to be addressed.
This is why we really try to educate people on appropriate use. And the other thing you have to think about is your insurance, right? Now, when you have an emergency, you have an emergency.
You will be treated. You will be taken care of.
Taken care of. But you also have to take into consideration that if you go to the emergency room for a cough or something that is non-emergent, you have copays. If you look on your insurance card, most insurance cards will have on there what is your copay to go to the primary care doctor. What is your copay to go to the emergency room? What is your copay to go to a specialist?
Right.
What is your copay to go to urgent care? So you have to be mindful. Again, we don't make those decisions.
We do not make those rules.
That is your insurance company.
That is your insurance company.
And so not only do we not make those rules, the hospital does not make those rules. It's the insurance company that makes those rules as to what the copay would be. And so you really need to know that if you go to urgent care, that you may very well have a copay. Right. And that's the patient's responsibility to pay the copay.
And in the emergency room, you go to the emergency room no matter what you're there for. Some insurances, you will have a copay no matter what. Even if you were supposed to be in the emergency room, you had a true emergency. Sometimes your insurance plan will indicate that you still had a copay from going into that emergency room. So again, we're not here to say that you should never go to the emergency room, but we are here to say that there are particular reasons why you should go to the emergency room. Because many of times people in the emergency room and they simply don't need to be there.
Yes.
They can go to their primary care doctor. They can go to the urgent care to get their acute illnesses taken care of.
And so again, to reiterate reasons to go to urgent care, sprains, falls, cuts that need sutures, if you need an x-ray, if you're having some
bad ear pain, if you're having significant pain when you urinate.
Yes.
Those are all reasons to go to urgent care. And again, if you go to the urgent care and the doctor at the urgent care feels that you need a higher level of care, they will certainly make that recommendation and for you to go to the emergency room.
Just be mindful that, again, urgent cares are put in place to reduce the burden that occurs in the emergency room, because we've all seen it. Like, either you
emergency room for 6, 7, 8, 9, 10 hours.
Yes.
And people get frustrated at the doctors and the nurses and the respiratory therapists, but they are working their tails off to see every patient. So it's not like they're sitting around eating bonbons and reading magazines or on their cell phones. They are working. It's just that there's so many people that need to be taken care of that ultimately people have to wait. And if your condition or illness is not emergent, you will wait.
So just be mindful. Urgent care is like it's the bridge between your doctor's office and the emergency room. Urgent cares are typically not open 24 hours. They typically have hours of operation, so you want to be mindful for that as well.
They are often open in the evening and on the weekend.
And the holidays.
And oftentimes your primary care office may be closed at that particular time. But again, certain things you don't have to go to the urgent care for. If you've had chronic illnesses going on, you don't have to go to the urgent care for that. It's more appropriate for that to be taken care of by your primary care doctor.
Absolutely. And another thing is some people will go to the urgent care because they have not had their medicines in a couple of days. So that is a primary care issue. So you really have to contact your primary care doctor because some urgent cares are connected to hospitals and they may be able to see the electronic medical record, but others may not. And they may not know what your issues are and know your full background and know what your other conditions are or what your other medications are. So that is really not the place to utilize the urgent care. You have to make sure that you are seeing your regular primary care physician because they're not going to know how to address your medication list or for that reason. So make sure that you are reaching out to your regular doctor's office.
Yes.
Another reason to use emergency room and not urgent care is if there has been an accidental ingestion or you're concerned that someone has been received some type of poisonous material. Now, you do also have the option of calling poison control, which you can very easily do at 1-800-222-1222. And they're available 24 hours and they will give you information as well that you need. But accidental ingestions, ER is the appropriate use for that.
And accidental ingestions can be someone's medication that they accidentally took the wrong doses of, or a child can get into the medications and take them. We also have to worry about cleaning supplies in the home, illicit drugs. So all of those things are considered ingestions and can be very harmful and dangerous. So yes, that poison control number that Dr. Wardlaw mentioned, but also that may be an indication to go to the emergency room.
Yes.
Most physician offices will have an on-call service. So if you really are not sure if this is an urgent care or emergency room visit, you can also give them a call. But let's be clear, you're not calling for a condition that you've been managing for the last month or 6 weeks, and you just have a question. You're calling because, again, if you have asthma and you're having a severe flare-up and it's just not responding to the medications, or if your child is just really not acting like themselves and you don't know what to do, again, you're not sure, call the doctor. But usually those instances, you're going to go to the emergency room. But if you are on the fence, you can give your doctor a call.
And when Dr. McDonald says the on-call system, she's talking about the availability after hours, after the regular business hours.
Yes.
And so those resources are typically available.
Yes. Okay. So multiple resources that you have available to you. So yes, the ER is there for a reason. There are instances where people absolutely need to go to the emergency room, but we want you to be clear when you do need to go to the emergency room. Instances where it's appropriate to go to urgent care. And again, if urgent care requires a higher level of care, they believe, they will send you off to the emergency room. And again, you always have your primary care doctor, which will also tell you when it's appropriate to go to the emergency room. And for me, I try to educate my patients in advance as to this is why you would need to go to the emergency room so that they understand what that next step would be.
And there you have it.
Thank you for joining us. We will see you on our next podcast. I think it was okay. I think we went back and we talked about it.
Yeah, it was a little short.